Hi, everyone. My name is Taylor Butler, and I am the marketing specialist at Sanova Dermatology, which has many practices throughout the Central Texas and Louisiana area. Ooh. And I am extremely excited that I have Dr. Candace Thrash here with me today to chat about something that is extremely exciting. So we are going we are going to chat a little bit about laser assisted drug delivery, which is a super fancy way of talking about pairing products and procedures, which I think is basically the best idea that anyone could have ever come up with. So I'm excited to chat with you about it today.
Excellent.
Yeah, so first things first, we're going to start talking about skincare. So tell me a little bit about how you got interested and invested in skincare.
So when I turned 21, my friends gave me a gift certificate to a kind of a high-end salon at the Arboretum. And I went and had my first facial. And like any good esthetician, at the end of the procedure, she suggested some products for me. And I tried the product suggestions that she made, and they were really awesome. And from there on out, I was hooked.
I mean, I love that. Nothing better than actually experiencing it and then getting that good quality skin. Super pumped. So, since you had that instance and that moment, tell us a little bit about your philosophy regarding skincare products in dermatology in general.
Sure. Well, I mean, I think there's a couple things. One is that you get what you pay for up to a point. And what I mean by that is if you buy a $13 vitamin C at Target, it's probably not going to be a good investment of your resources. Or if you buy a $300 product at Neiman Marcus, it might be a little bit overpriced. So up to a certain point, I think you get what you pay for. Vitamin C in particular, it needs to be at a certain pH and it needs to be at a certain concentration and it needs to be in an opaque container to work. And when products like that are mass produced and sold at drugstores for $15 or so, then they probably don't have the same efficacy of a product that has been manufactured a little bit more thoughtfully. So I do believe that the up to a certain point, you get what you pay for with products.
I love that. I think that's awesome. And I will say, hint, hint, I love the fact that Sonova does offer kind of a range of products at our various
For
locations. I
sure.
know specifically at Bee Cave and Lakeway, which is where Dr. Candace Thrash works, that they do offer a wide range that can vary in price, which is great for people at all levels, which is fantastic.
For
So
sure.
you were diving into a little bit of specifics about skincare. So tell us what products that you currently are loving for your skin.
Yeah, so I definitely think that we don't need to do everything. I mean, obviously, in my bathroom, I have got every great product there is, but I don't put every single product on every day. Just like with with superfoods, we know that walnuts and quinoa and salmon and blueberries and turmeric and all these things are good for us, but we don't necessarily want to eat them all in the same meal. We don't need to put every good skin ingredient on our skin at the same time. But there's a couple of things that I'm always loyal to. I use a vitamin C every single day, and the vitamin C that I use happens to be a brand called Jan Marini, and their product is Siesta. I use it because I like the way it feels. I started using it 20 years ago. I like the results that I get, so I'm loyal to that one. But CE ferulic is one that I recommend to my patients every day because it's kind of the gold standard of vitamin C. But I definitely use a good vitamin C every day. In terms of eye cream, right now I'm using AGE, which is by SkinCeuticals. AGE helps reduce something called glycation products, and glycation products are more common when your blood sugar tends to run a little bit higher, which mine does. So I use that to help kind of prevent some of the breakdown of collagen that can happen as a result of the formation of something called glycation products. So that's my eye cream. Transformation by Jan Marini is my moisturizer. I love that one. Isden sunscreen is a really great product. I like that. And then my two other favorite serums are Dose. We have the Dose machine at the Bee Cave office, And Dose is a SkinCeuticals product where you answer a questionnaire and it customizes a product specific to your skin type and your needs. So, for instance, for me, I'm working more on hydration, fine lines, pigmentation, and it puts those ingredients in it that I need. So I use that one. And then I use a stem cell growth factor product called Plated every night. And I love that product too. So, like I said, I'm a dermatologist. That's a lot of products. Not everybody needs to use that many products. But I probably have 6 or 8 other ones that I'm not using at the moment because I'm a product junkie.
I know. I feel like we get blessed in dermatology with access to some of these products, and then you just have so many of them, and it's like trying to figure out the right combination of them. So that's really fun. But quick note, I will tell you, SkinCeuticals Custom Dose is relatively newer at the Beach Haven Lakeway location, and it is also offered at our Sunny Ranch location. I love SkinCeuticals Custom Dose. I will tell you that the formulation that I had worked with the esthetician that helped me figure it out made my skin feel so soft, and I loved it. So I like
Yeah,
literally, it's kind of like you talking about your Giannarini um, vitamin C. It's like you just remember how your skin felt, and it's like it makes your heart happy. But anyways,
for
um,
sure.
so
For
we talked
sure.
about the skincare products and talked a little bit about what you like to use and how it can be beneficial for the skin. So tell us a little bit about how pairing those products that you love with procedures can be beneficial.
Sure. So we put the products on our skin, and the products are formulated to penetrate down through the stratum corneum, but they can only do that to a certain degree. So the active ingredients in our products, they're molecules, right? And the molecules have a certain size to them. And our protective barrier for our skin is designed to prevent things from being able to get in. So only so much of the product that we apply actually gets absorbed into our skin. So, if we can find ways to, in a safe and healthy manner, create little channels into the skin, then those products can penetrate better and get a better result. Clear and Brilliant laser is a laser that we have in our office. And when that laser first launched about 10 years ago, they actually did a study with SkinCeuticals taking CE ferulic, their gold standard vitamin C, and applying it right after doing the Permea handpiece on the Clear and Brilliant laser. And they found not only did the product penetrate up to 10 times better right after the laser treatment, and I believe it was for up to 7 days afterwards, but patients were better protected from UV light for up to a week afterwards because of the better absorption that they got from using the CE ferulic after the laser treatment.
That's amazing because I feel like we're already investing money into getting the skincare and we're really trying to work on making our skin look better and healthier. And if we're investing in things like lasers, which can obviously be more expensive than skincare, the idea of being able to amplify those results and the response from that stuff is fantastic. Science, love that. Fantastic.
For
So
sure.
you're talking about lasers. Obviously, there's a huge wide array of types of lasers. So is this extra penetration going to be valid for what type of lasers? Any type of
Yeah.
laser?
So, no, I mean, obviously, if you're getting laser hair removal, the target of that laser is the hair follicle beneath the skin. So it doesn't affect the skin on top. So that's not going to do it. Ablative lasers, which are like CO2 laser resurfacing, and another one called erbium YAG, those actually take off that top layer of skin. So obviously, you're going to get more penetration with those. But those can be, you have to be really committed to go through those treatments. So for patients who want something with a little bit less downtime, we have fractionated laser resurfacing where we create tiny channels in one portion of the skin, but not in the portion next to it, and then one portion, but not in the portion next to it. And because we're treating the skin kind of like a sieve in that way, it heals a lot faster. So non-ablative fractionated laser resurfacing is kind of the trend. Clear and Brilliant and Resurfix in our office. I think some of the offices have Halo. That's another one that would be a fractionated laser resurfacing. I'm sure lots of the locations have some form of non-ablative fractionated laser resurfacing. And those are the kind of treatments where you're going to have low downtime and still get significant benefit. And it's going to create those little channels where the product can penetrate better.
That's fantastic. I love that. So we talked a little bit about how it works. Can you go into a little bit more about the science of it and the research that has been done on this?
Yeah. So there's been a study that came out recently looking at an ingredient called tranexamic acid, and wanting to really see how well that product penetrated by itself and how much better penetration they could get after doing a laser. So they used a certain laser. It's a similar one to our Clear and Brilliant laser handpiece. They treated the patient. They applied the topical tranexamic acid, and then they looked at the skin afterwards, and they found 17 times as much absorption in patients who'd had the laser
Wow.
type of treatment as didn't have the laser treatment. And not only did they see that, numeric value, but clinically looking at photographs, patients got significant improvement in pigmentation after having had the laser treatment and then applying the product compared to either having the laser treatment alone or applying the product alone.
That's I mean, I was going to say insane. That's amazing. Those results got to have to be fantastic. Um,
Yeah.
what is tranexamic acid? Just because I feel like I'm.
So it's a relative newcomer to the cosmeceutical scene. So tranexamic acid was is intended when taken orally to help with bleeding. Sometimes we'll even use it for patients to prevent bruising after injectable procedures. But applied topically, off label, it has been shown to help improve pigmentation. So, actually, your custom dose may very well have some tranexamic acid in it because that's one of the ingredients that we can formulate in that custom dose. But even for offices that don't have the custom dose, the compounding pharmacies for us, we can get them to compound a product that has topical tranexamic acid in it. It's a derivative of lysine, to answer your question.
Oh, okay. I love that. Question another question for you. A little off book. But how do how do we decide what products to use? You mentioned tranexamic acid and custom dose. How do we make the decision, or is there a specific type of product that is best utilized after these procedures?
Yes, I think topical vitamin C and topical tranexamic acid are absolutely the best things that we can do. There's probably a role for stem cell growth factors as well after these procedures. And then, of course, platelet rich plasma is another option. Platelet rich plasma is when we draw your blood and spin it down and concentrate your own growth factors and apply that after laser or microneedling so that we get better absorption of that product.
I love that. No, that's awesome. I think that's fantastic. And what I love is that we have so many fantastic and well knowledge providers at all of our clinics, our MDs, our PAs, our estheticians that have all this knowledge, this gold that can help us amplify our results and make us look as beautiful as we hope to be.
And
Um,
we've got a lot of tools in our tool belt too, which is nice.
Yeah, no, I think that's fantastic. Lots of various ways to get to similar places, which is awesome.
Sure.
So now that we've learned a little bit about the amazing opportunity that lies ahead for us in partnering these procedures and these skincare items, how can we take advantage of this?
I think the first thing to do is to meet with the esthetician, do a consult with the esthetician and talk about what your goals are, what your budget is, and what are the primary things that you want to work on. And then they can determine is microneedling or one of these non ablative laser treatments going to help you get towards your goal. And if that is the best option for you, then pairing it with a good product and probably purchasing that product at your consultation so that you can start using it in advance of your procedure, reiterating at your procedure what your goals are so that the esthetician can apply products that contain those active ingredients during or immediately after your procedure, and then being really consistent twice a day for at least 7 days, and then daily beyond that with your products afterwards is going to give you the best results. So what that means then is you have to include product in your beauty budget. The laser is the big ticket item, and after we've purchased that package of laser treatments, we don't feel like we have anything left for product. I'll get that later, but you're really going to see significantly, exponentially more benefit if you go ahead and invest in that good product at that time.
Yeah, for sure. I just feel like you've invested that effort into it. Why not make sure that you're getting the best results that you can? Even in medical fields, I feel like that's something that they try to do, and this is kind of the same thing. It's the more a medically inclined cosmetic treatment, which is really fantastic. But I really want to thank you for sharing all of this wealth of knowledge with us and taking the time to showcase this really great pairing of products and procedures. And on top of the other ways that you had mentioned, preparing your beauty budget, which I love the idea of a beauty budget, and then partnering with your esthetician and your providers at a dermatology office to figure out what's best for you. Hint, hint, we have our fall cosmetic event taking place like right now. So it's a great time to
Sure.
talk with your providers and potentially even get a greater deal than even just partnering the product and the procedure.
Sure. Yep. I think now's a great time to take advantage of it.
I love it. And it's fall, so it's like laser season. It's all of the great things. The powers have combined. But I just
Fall and winter are the best time to do your laser. You know, spring and summer, it's a little bit more difficult because of all the sun exposure. Fall and winter time is the good time to do it.
so basically Dr. Candace Thrash said the time is now. So
The
thank
time
you
is
so
now.
thank you so much for the time. It was so lovely speaking with you. I can't wait to see you again.
All right. Thanks, Taylor. Bye
Thank you so
bye.
much.